In March last year, Chelsea Kawesa survived death by a whisker. She was at work having lunch when all of a sudden she began experiencing difficulty in breathing, heart palpitations, and then general body weakness.
Because I was working in a hospital. So I went to one of my friend doctors and I asked him, "Hey doctor, what does it mean to have a lot of palpitations and shortness in breath?" And he told me, "Have you been on the stairs?" Namugamba, "No, I've not been on the stairs." And he's like, "Okay, first relax and then take a deep breath and then you'll get fine."
Kawesa returned to her workstation and indeed, everything seemed to have returned to normal. However, 2 hours later, she began gasping for air.
It got out of hand, so I became anxious, like I was wondering, now what is this? What is really causing this? So I go straight away to the emergency room and I tell the nurse, "You check me, I'm not feeling well."
The nurse summoned the doctor and they performed a range of tests on her, which all returned negative. The doctor then asked Kawesa if she had had a fall or an accident.
Then he's like, "Okay, fine. This could be a what? A clot, but do you have a risk factor?" So I asked him, "What do you mean by a risk factor?" Then he's like, "Okay, do you have an implant? There are different other things that he told me." So when he mentioned about the implant, I'm like, "Yes, I have an implant." Then
3 months after a C-section delivery, Kawesa's gynecologist had inserted an implant in her arm. The doctor recommended that she undergo a CT scan. The scan showed a blood clot in one of her lungs.
I got so worried. I began thinking about so many things. So one of the doctors actually scared me. He's like, "This could cause death, and true, it does. People die. People really die when they don't know what exactly is killing them."
While blood clotting is vital to stop bleeding when one of the blood vessels has been punctured, Dr. Joseph Mutiaba, a physician with Mulago Hospital, says blood clots can be dangerous if they form in the wrong place.
We have the arterial blood clots, which for them they're dependent on the status of your fats. If you have too much fats in the blood, and so you can form these blood clots, and they are pumped because the artery is pumped. They can go to the brain to cause the strokes.
Dr. Mutiaba adds that arterial blood clots can also flow downwards and block the arteries in the lower parts of the leg.
Someone can present when I've been okay, but my leg is swollen. It's even bigger than the other one. It's warmer when I touch it. It's warm, but it's painless. They see them more in people with diabetes, people with hypertension, people with too much fats in their bodies, and people who have a sedentary lifestyle, certainly.
On the other hand, venous clots can move through the bloodstream and lodge in small blood vessels in the lungs.
The lungs are the primary organs for gaseous exchange. So if you have a clot in the lungs, then it interrupts that process of gaseous exchange. The commonest of those is difficulty in breathing. Then there are other symptoms like coughing up blood, which we call hemoptysis. And then if the clot is very big, sometimes people faint.
Various conditions can cause blood clots in the body, such as surgery, being involved in an accident, fractures, and diseases like cancer. Other risk factors are the exogenous hormones on the market that can cause changes in the blood. Lack of movement and a sedentary lifestyle are also a risk factor.
This immobility could be because someone is on a plane or is traveling and is going to be immobile for a long time. Sometimes it could be that someone had a fracture and their limb or part of the body is immobilized as part of the treatment.
Kawesa was given medication to regulate the condition, and with time, the pain disappeared. The implant was also removed.
They gave me a period of 6 months. So I was on medication. They gave me a Pixaban. I took a Pixaban, then later on they changed me because I was getting reactions to it. I began having black spots on my body. So when they changed my medication, I went to Varoxaban, something of that kind. Yeah, Varoxaban. The clot stopped.
Most blood clots do not cause pain, and yet pain or loss of function is what motivates people to go to hospitals.
If someone has a clot in the leg, it is not advisable for them to massage that place, because you can demobilize the clot and then it goes into the lung. So we usually recommend people, if you get swelling, which is usually it is one side, and that has come without any known cause, you go to hospital first and then they make the diagnosis.
Frequent wellness checks are the only way to detect blood clots before they cause fatal consequences.
When you come and tell me your uncle, your auntie, people had a clot, definitely in my mind, oh, I'm from a surgery, or I've been traveling from Africa to America, I've been traveling for over these years, I've been seated. So these are some of the things. I have diabetes, I have hypertension, I have all these other conditions. Initially, I had a cancer before, something. So there's a history that will point that possibility of having a clot is so high.
The simplest way to prevent blood clots from developing is to keep active. At least one should walk for 30 minutes a day and drink lots of water. Today, Kawesa no longer works in a hospital environment.
The company felt I wasn't going to give more of my potential to the company, and they felt my disease or my sickness was going to affect them in a great way. I decided to quit. I feel they didn't figure out how I felt at that moment, that the traumatization that I was getting, my mental state.
She opened up an events planning company and bridal shop. She has also abandoned the use of all contraceptives. If detected early, blood clots can be treated and cured depending on their cause. Some, however, are treated indefinitely, especially if the patient is suffering from an incurable cancer.
Thank you.